NDILEKA HEMPE and her brother Lulama Nabo buried their sister a few weeks ago. They said Lindiwe was struggling to breathe, but she didn't immediately go to the hospital, thinking whatever she had wasn't serious. When she eventually got tested for COVID-19, it was too late. By then, another sister was also gravely ill.
The younger sister was still in the hospital in ICU when the elder one died. We were still praying for her to survive, but then there was this blow of the elder one dying while we were still praying for that one to survive. And we were worried that that one, when she comes out of the hospital, she would be told that her sister is no more.
Nomtetelelo Siko died a few days after her big sister Lindiwe. South Africa's coronavirus infection total since the first case in March is now more than 1 million. During the festive season, thousands of South Africans travelled across the country visiting friends and family. Some attended large gatherings without wearing masks or practicing social distancing. That's why health experts say they are not surprised by the rise in numbers. Port Elizabeth is a coronavirus hotspot in the Eastern Cape, one of the provinces where the new variant was identified in South Africa. Doctors and nurses say the sharp increase in infections is putting more strain on already struggling medical facilities. The new variant has also been identified in other parts of the country. Several hospitals and medical centres say many wards are full. There is a shortage of ventilators, ICU beds and staff.
Certainly with the second wave, we've seen more healthcare workers also unfortunately dying from the disease. So the burden is a heavy one. You lose people you work with for years, but still you have to continue. You have to continue. There's not enough time for grieving.
South Africa's President, Cyril Ramaphosa, has tightened COVID-19 restrictions, banning alcohol sales, extending a nationwide curfew, and making the wearing of masks in public a legal requirement. So far, most people in South Africa who've tested positive for COVID-19 have recovered. But some doctors say, unlike in the first wave, when the elderly were most affected, this time they're seeing more young people in their 30s and 40s getting seriously ill or even dying from the disease. Haru, Mutasa, Jazeera, Port Elizabeth.